Thank you, Pat. Thank you for having me today. This has been an incredibly informative day. It's always a challenge right after lunch. Everybody's a little tired, especially after pasta lunch, and then to talk about, such a riveting topic as healthcare. I have to say, I've done a lot of regional presentations. I've never had this much professional lighting on me. I feel like I have to break dance at the end or something. But no, I'm glad to be here. I had to pick between a couple of different hot topics. And in the title on the brochure, believe it or not, I'm not going to talk about that. If there's such a thing as COVID fatigue, I'm like COVID flatlined. So I'm going to talk about some other top trends. And I really want to relate a lot of it back to some of the topics that we talked about today related to microtransit. So, that's a long, I told you to skip half that. Dawn sent you the long, but if you think people hate parking in hospitals, try doing food service. I did food service contract once, and I think it's hated even more. But anyway, this is my background, but who I am is a proud mom of 3 and wife from Northeast Ohio. So I still live in Cleveland here today. Okay, so today's topic, I'm going to talk about kind of the trifecta of really the challenges and opportunities in healthcare. I enjoyed learning that this morning. Health. A lot of people use the word safety related to virus and disease, but it was really about personal health, customer service. Kendra said it well, the patient experience, the customer experience, and then efficiency. So really we're in a world, right, of wash your hands, disinfect highly touched surfaces, but do it with a smile on your face and high-level service, but oh, by the way, do it with less and cut cost, right? Trifecta of challenges and opportunities. So what does this mean to not only healthcare, but really the entire country? This isn't just healthcare. So in the past, I'd go to a regional conference, and anybody in here that would have anything to do with working with a hospital, my presentation would be applicable. But I feel like now more than ever, this presentation is applicable to everybody, getting back to normal businesses and learning. So everything from virus mitigation to infectious disease to overall wellness, of course being cost-conscious and efficient, and then customer experience in healthcare is really about compassion and empathy. So when I say healthcare operations, what does that mean specific to us? That's everything from valet service to shuttle, parking management. Listening about Stony Brook is so interesting. We were talking a little bit at lunch about competing priorities, and so many different multifaceted end users, from patients, their family members, to physicians, to professors, to visitors and vendors, are all of our customers in parking and transportation when it comes to hospital and university campuses, and a lot with facility maintenance and special events. So getting right into the priorities on health and wellness. Viruses always have been, they always will be. A virus's job is to mutate and find new ways to attack us. So hopefully we've taken what we've learned this past 2 years, or those of us in healthcare have always known. How many times have I washed my hands sitting at the table, those sitting with me? About 10 times today, right? A little bit obsessive, but. So we're gonna talk a little bit about these virus mitigation strategies because, let's take, for example, our shuttle drivers or a transit driver. I had a couple of drivers and managers over the past year say to me, or even 2 years ago, June of 2020. First it was no mask, then it was mask. And we just adapted, evolved, and learned and trained. And he said, well, now that everyone's wearing a mask, I don't have to disinfect the shuttles every hour, right? It's a hospital shuttle taking nurses from downtown Metro DC to MedStar Washington Hospital Center. Yes, we need to disinfect highly touched surfaces. Are we going to continue those practices going forward? We should, in all industries. But I also think it's very, very important that all industries understand, all of our employees. Today's been a lot technology, transit. LAZ is all about people. We're the people of that, okay? So my 30 minutes here is really gonna be on your frontline caregivers and that service and that safety. But we need to get back to a balanced approach on overall human health and wellness. Yes, there are viruses, but there's also infectious disease. We've seen a significant problem with mental health in this country, and especially even within our teenagers, not as active. Teenage obesity has risen. So getting back to proactive health. Does anyone know what the #1 cause of death in the United States is and has been for almost 2 decades?
Car accidents?
So accidents is like 3rd or 4th.
Obesity.
So obesity is a factor to this death. Heart disease. disease, by far, 31% of deaths. Heart disease and then cancer. You know, some of which is not avoidable, but a lot of it is avoidable. And, you know, there are so many things that we need to focus on for our own health to mitigate some of those. So again, when we talk about a balanced approach to overall human health and wellness, are we washing our hands to avoid a virus, an infectious disease, but also we getting back to making sure that we're managing our mental health. But I think this is really important for all of our frontline employees in parking and transportation. Most of them didn't stop working throughout the pandemic over the last 2 years, and they were just bombarded with mitigation training, mitigation, virus mitigation, and we are really taking a 180 now to try to focus on proactive wellness and mental health. It's also really important, I can't help but just kind of load all this in here, to understand the difference between an airborne pathogen and a bloodborne pathogen. It would drive me nuts seeing people with gloves on in the grocery store and then scratching their eye. I've got all kinds of good trivia. What's the number one way an airborne pathogen enters your system? It's actually your eyes. And usually it comes from touching your eyes. So again, an airborne pathogen enters your eyes, nose, and mouth. And bloodborne pathogen enters your bloodstream. So understanding these different types of infectious disease, and I can't stress enough for our front line that deals with the population going forward. Any particular virus isn't done or gone. It's always going to be around. Viruses always have been and always will be. So getting back to truly understanding overall health, and then ensuring as we're training the employees that, again, it's not just about infectious disease mitigation, but also about their own personal health. So this is just an acronym that we use to throw out a few ideas to throw out there. This is always has been, always will be, these practices. Giving a couple of quick tips and tricks for our front line going forward in parking and transportation for how much we touch cars and we touch the buses and we interact with the public. This is so important, not just in healthcare, but across our industry. Truly understanding, identifying what are highly touched surfaces and how to disinfect. Building a checklist for the front line. Kudos, I had an employee at a hospital that was out in the garage that had really expensive and hard to get disinfectant 2 years ago. Wiping down with the disinfectant, all the walls and all the stairs, and you still clean surfaces normally with soap and water, and then you disinfect highly touched surfaces, and then understand how to use an EPA registered disinfectant. So a lot of information here that I'll send as a follow-up, but it's really important for our employees to know this, and I just hope that we can take what we learned the past 2 years outside of the healthcare world and continue to do these best practices. How can we continue to optimize touchless technology? I love the touchless technology where I tap my debit card at the grocery store, okay, touchless, and then I still have to enter my PIN. I'm like, all right, maybe I need to get a touchless credit card or something, because I'm still touching it and washing my hands. But this, what industry do you think really taught the older generation how to use a QR code in the past 18 months? Anybody know? Restaurants. Because even me, QR code, that's how you got your menu, right? So now, QR codes and app-based systems, are becoming more user-friendly to an older population, or even myself who isn't the most tech savvy. So optimizing technology, ensuring that we're following PPE protocol and CDC guidelines. So this still going forward as things change and adapt, really making sure our frontline understands what all these things do and don't do, and then of course your own personal accountability. Okay, so that doesn't stop. We need to continue to train our employees, especially in hospitals, but all of our frontline employees, how to keep themselves healthy and safe. But then, like I mentioned, what about customer service? So we spent the last 2 years like this. I don't know who's a Big Bang Theory fan, but I love Sheldon. So Sheldon is just disinfecting the air constantly. But this is kind of the world we live in, and I know we're coming out of that, and I know at LAZ most of our hotels have reopened across the country, but we are still a little bit in this, I wouldn't say kind of fear-based service. Cautious is probably the right term, but I know in healthcare you're still taking care of NICU patient families, and you're still taking care of cancer patients, and we need to do that warm and friendly with a smile. So how do we now balance service, be it shuttle drivers, valet drivers, cashiers, in our industry by truly teaching compassion and empathy. So our care model, the compassionate service model, is what we do in healthcare, but now we're adapting it in all of our other lines of business. Shuttle buses that are for municipalities or universities, training empathy, especially over what's happened in the past 18 months to 2 years. You know, we never know what someone else is going through in any number of ways. I hope that over the past 18 months, we can apply empathy in our training in all lines of business, not just in my world in healthcare. So we use the word compassion because it's sympathy and empathy coupled with a desire to help. What a perfect definition of compassionate service that we can apply in our industry. And then, you know, really when it comes to service too, and I'm hearing all the discussions this morning on all these different, you know, ride share versus microtransit. I mean, it's not just in healthcare and other industries, but again, that service level we're getting back to, as everyone's getting back to business, that competition of customer choice. So we need to create that exceptional customer experience. And then how do we do that though in areas like mine in healthcare where they are still wearing a surgical mask? And we have to get down to the nitty gritty with our training of our front line to really smile with the eyes, to speak more clearly and articulate, to use more hand gestures as we're doing some of these things in some industries, still through a mask. Increase patience. So hospitals want to increase patients TS. We need to increase patients CE. Again, be more patient with those who may still be fearful getting back to hospitals, you know, getting on a shuttle bus to go to an appointment, getting on a shuttle bus to get back to work for the first time. You know, are our frontline employees in parking and transportation truly, again, applying empathy and patience to what they do, even when they might be going through some of their own stress. And that's where it really comes to, I think, increasing our employee appreciation and employee engagement practices. I think, again, in a world where, you know, we're still focused on virus mitigation strategies and people are still cautious or fearful, and then, oh, we got to give high quality customer service. Oh, by the way, do more with less, work a double because we don't have enough people to work. This is still a very stressful environment for our front line. So we need to step up the efforts. So, you know, Kevin knows this in New York, so we just shipped out, those are my kids, actually a couple years ago, my 14-year-old's 6'1" now. We bought up all the Girl Scout cookies from the school and sent them out to the front line. So it's just, what are those little things that we can do that now more than ever go such a long way? I mean, the people, frontline people of parking and shuttle and transportation in our industry, we need to get out on the front line, shake hands, appreciate them as much as we possibly can. And it really, really does go a long way. But then also addressing mental health. I think we have to address this just front on. I know for my employees, 1,400 hospital employees across the last 18 months, we grew by 200 employees. So they're exhausted. And I feel like there's a little bit of delayed exhaustion. And we're really trying to overly celebrate them, but also to promote our wellness initiatives like Movement Monday, Feel Good Friday, promoting a yoga class, whatever it is. But I think more important than ever is having conversations. How are you doing? How are you feeling? With our front line, it's just really, really important. Now, all of the touchy-feely customer service stuff I could talk about all day, right? Compassionate service in hospitals related to parking and transportation. Kendra, you're talking about, you know, getting into parking. How did any of us kind of get there, right? Nobody went for a master's degree in parking, but we all ended up here. And I too kind of fell in love with that touch point at the Cleveland Clinic. But patient experience and customer service in our healthcare industry, it's not just the touchy-feely, we better be nice. There's a huge financial implication or financial incentive to our hospitals, okay? So let's talk healthcare reform. Healthcare reform. Couple of key things here on this timeline, really pushing towards free preventative services in 2011, the open marketplace in 2013. But 2012 and 2015, the financial implications. Payment linked to quality outcomes. In 2015, payment linked to value or experience. So payment. I go to the hospital for knee surgery, right? And I'm a Medicare patient. When I'm done with my surgery, Medicare is going to pay Cleveland Clinic for my surgery. And there's all these stipulations and variables, but pre-2012, so 2012, now it's linked to quality outcomes. Was it the correct knee? Yeah, believe it or not, that happens, right? Was there an actual error or omission? Was there an infection? Was there a readmission? So now there's all these quality outcomes. So if my surgery costs $40,000 and Medicare, CMS, Center for Medicare and Medicaid Services, which is the United States government funded, Department of Health and Human Services, is gonna give $35,000 for that surgery, but there's an infection, there's a readmission, there's gonna be all these checkpoints on that, and they're not gonna get that full reimbursement. 2015, they said, and oh, by the way, yes, you had knee surgery, and you know, it was the proper knee, no infection, no readmission, she's rehab already. Okay, now I'm gonna give her a survey and ask her about her experience. How did you feel about your experience? What if the last thing that happened to me was the shuttle driver taking me to my parking was rude? Or the last thing that happened was the valet took my quarters, right? They always say that happens. So parking and transportation is the first and last impression at so many of these hospitals. So now it's not just, hey, LAZ parking. And I'll never forget being on the other side of Cleveland Clinic, you know, we can increase your parking revenue by 20%. Well, what are you gonna do? Double charge a cancer patient? Like, no, that $6 at the garage does not matter in the grand scheme, and I was still a $40 million book of business. But now, CMS reimbursement is directly linked to the overall experience of the hospital. And parking and transportation is hugely important to that. So if you think about payment, how much money do you think Medicare or Medicaid pays to hospitals every year? Yeah, $1.2 trillion. And this number's already 2 years old. $1.2 trillion. So that's a big piece of the pie, right? So do you want to raise the parking rate from 6 to 8? So everything related to parking and transportation in healthcare is different. It's a different methodology, it's a different approach. It is all about the patient experience, but also being fiscal and fiscally accountable and frugal. So I've had to retrain some LAZ folks across the country when they say too, you know, we can cut costs or increase revenue. Well, let's talk about fiscal accountability. Fiscal accountability. We had a great, I've known T2 systems for so many years, and I know it's grown so much in its applicability, and it's not always fully optimized. Somebody mentioned double map before. I've used double map, I've used translog, and not often are these systems fully optimized to really increase efficiency, increase productivity, and reduce costs. So this is where we can talk a little bit of technology, all the different types of technology and how they can be used to be more cost efficient or to optimize revenue. So obviously parks, you know, Kaiser Oakland still pops the gates at night, drives me absolutely crazy. So it's not just about 24/7 revenue control systems, right? It's about managing your monthlies, it's about looking at your hourly volumes and making educated decisions on price point. One of the things I'll tell you about, and we did a technology study, and I didn't want to jump in when you were getting all the questions via, right, about via, but hospitals are so interested in microtransit, and the benefit, they don't want to put their patient in Uber or Lyft. A surgical patient that doesn't have a ride home, they don't want to put them in, you know, back of Joe's minivan. That might smell like cigarette smoke or have Cheerios on the seat, which I drive a minivan with 3 kids, so there's Cheerios on it. No disrespect to Joe's minivan. But, so I'm listening to you from a hospital brain all over the country and thinking, well, what's so appealing is the branded vehicle, the uniform driver, the consistency of training, the DOT regulations, and there really is a space for that. And I like how you also said, and there's still a space for Uber Lyft. Right? I think there was a millennial in the room that was like, but what about Uber Lyft? What about Uber Lyft? Right? I mean, that is the demand, that is the go-to. But there really is a huge space for that microtransit in healthcare. It's sad to see at the front line of hospitals how many patients do not have a ride home after surgery or do not have a ride to their appointment. Now that's sad to see, but let's think about the financial implication, right? So a no-show surgical appointment, we just missed out on $6 of parking revenue. No, they may have just missed out on $40,000 billable that day, right? And then if they don't get the quality experience from parking or transportation, which is the first and last impression, then it can ultimately impact their HCAHPS scores and impact the Medicare, Medicaid reimbursement for the hospital. So it's pretty incredible in healthcare, you know, how important our industry is. and how uniquely different everything is. And I'll give you just a couple more examples related to technology. And if you can't tell, for those of you who've heard me speak before, this is 3 topics kind of rolled into one. So I'm just kind of hitting high level everything that we're thinking about and talking about in healthcare. But I'll give you another example. 10 years ago, I went to IPMI to look at valet technology, and back then, it was just a slower end user process, and very slow. When I say end user, I meant the valet captain. And all I could think of is, this is going to impede the eye contact with the patient. This is going to impede I would rather him talk to the patient, fill out a ticket with a pencil. Sorry, Chris, this is many years ago. I'm all valet technology now, I'm sold. But my mindset was so different. My mindset to this day is so different on every single park system. You say app to me, and I think of my grandpa going to his cancer treatment. He doesn't want an app, but he now knows how to use a QR code. So how are we adapting to that population in healthcare? How are we providing access to care through microtransit, through paratransit, and utilizing partnerships? I think where it relates to really today's topic in microtransit, obviously we're in the large shuttle space. But what I thought was really interesting throughout several presentations today is there is a need for all 3. There's absolutely an inherent need for all 3. And what I mean by that is a LAZ 40-passenger shuttle running on a scheduled route full of nurses in downtown Metro DC, contracted to LAZ because we're also the valet, we're also running the parking, so it's a holistic strategic approach for them. But then there's also Uber and Lyft for some events or some other people taking it, but then there still is that gap and that it really desperate need for microtransit or paratransit, and in a hospital world, a branded vehicle with a consistent training, a consistent uniform is really important there. Everybody talks about frictionless with LPR, right? Also very enticing. The first thing I think of is that that's very confusing to a patient and visitor, right? If that's a 20-year-old college student, they know it's there and they stop and they see the green light and it reads their license plate. But I also think college students, they won't give you the right license plate and then they're gonna cheat and they're gonna park over here, right? I didn't mitigate all those challenges, but again, a very, very different mindset in healthcare, parking, and transportation. It's not just the end user. And I think about, too, we use the word vulnerable. So it's not just an elderly population. It's, my best friend has been battling brain cancer for 6 years. So diagnosed at 38, 2 young kids. Imagine her anxiety every time. She's leaving work, she's dropping off the kids, she's leaving work, and then she's going for radiation at Emory. She arrives at that valet. Right? So the vulnerability of the patients and visitors in healthcare that are accessing parking, valet, our garages, our shuttles, it's just understanding the different need of that customer base and how can we adapt to that need with either technology options. I always say there's no wrong option, but per se, because hey, maybe my grandpa would get really good at an app, right? I think he might even have Park Mobile, I'm not sure. But how can we also have QR code? How can he also pay before he goes and maybe print a barcode ticket? So all those kind of things that we want to understand and really cater to all different populations, but definitely vulnerable customers. So last but not least, just and how to utilize business intelligence. So again, kind of all these topics rolled up into one. So now, more important than ever, we're asked to do more with less. Is anyone in this room not asked to do more with less right now? Who's asked to do more with less? Let me say it that way. Make you, after a pasta lunch, make you lift your arm. All right, so healthcare trends. Nobody wanted to hear about virus mitigation, but I had to get a few messages in there because we have to keep doing it, right? So we have to keep our employees healthy and safe on the front line. We need to bring them back into offices. We need to keep our shuttles and our vehicles and our valet vehicles safe and clean. And then, oh, by the way, we have to give exceptional customer service as people get back to regular life, and there's all these options and competing choice, and we need to worry about our own revenue and business. And then, oh, by the way, do more with less. So now more than ever is a good time to utilize data analytics, we heard that in a few presentations this morning, and business intelligence to look for cost efficiencies, alternative areas of revenue, so off-peak garage utilized and marketed for a special event. Looking at shuttle routes. I thought it was incredibly interesting. It's less time to all go to a central point. It's like Six Sigma spaghetti diagram. program, where we did that when we were building a hospital in Abu Dhabi for Cleveland Clinic, and we were trying to adapt to valet the Royals. You guys think it's scary to have a valet ding in Manhattan? Yeah. Try valet parking one of the Royals. That was definitely a challenge. I wouldn't even know what one of those vehicles is called. But definitely the claim is more than my house would ever be. So, but trying to understand flow, right? Strategic flow, trying to utilize data, mapping, route mapping, looking at route reliability for customer experience, looking at valet metrics by hour so you can find that staffing efficiency sweet spot, maybe bring in some more part-timers, which some more people are looking for now. So there's just a lot of ways to analyze data to really get more, to improve service and be more cost effective. So that was a lot in 30 minutes, 25 minutes. Any questions?